Hello, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers. Today, we're discussing something that's becoming more and more relevant for patients facing chronic pain or injury, how breakthroughs, non-surgical therapies are helping many patients avoid surgery and recover naturally. That may sound counterintuitive. After all, when you're dealing with severe back pain, a torn shoulder, rotator cuff, or knee degeneration, surgery often feels like the only option. But the truth is, many of these conditions can now be treated successfully using non-surgical therapies. We've seen hundreds of patients return to their active lives pain-free, mobile, and strong without ever stepping into an operating room. And for those of you still suffering, if you've already gone under the knife, we've helped people in that situation as well. So in this video, I'll explain why surgery isn't always the best path, what modern non-invasive therapies we use, how they work, and what kind of recovery timeline patients can expect. The problem with the surgery first mindset. Surgery can absolutely save lives when it's necessary, but too often it's recommended too early. Many patients are told they need surgery before conservative or regenerative options are even explored. The issue is that surgery can remove or repair damaged tissue, but it doesn't always address why that tissue was damaged in the first place. Your body is an integrated system. Muscles, joints, and nerves all communicate. When one area weakens or becomes unstable, others begin to compensate. Over time, that compensation leads to misalignment, joint overload, and recurring pain. We often see this pattern in joint and spine cases. A herniated disc that developed years of poor posture, a rotator cuff that developed after months of shoulder instability, a degenerative knee that worsened from altered gait mechanics. Surgery might remove the damaged tissue, but if those movement patterns stay uncorrected, the stress simply shifts somewhere else, often leading to new pain or repeated surgeries. That's why understanding the mechanics behind pain is so critical. What happens inside the body after injury? When injury occurs, your body goes into a protective state. Certain muscles shut down, others overactivate, and your brain begins to remap movement patterns to avoid pain. This creates compensation, small misalignments that cause friction, inflammation, and nerve irritation. Over time, that compensation pattern becomes your new normal. You may start feeling tightness, limited range of motion, or even tingling or numbness, all signals that your nervous system is under stress. Surgery can remove a damaged disc or repair a tendon, but it can't retrain those movement patterns or restore coordination. That's where breakthrough conservative care comes in. Treatments that work with your body's natural healing system, not against them. Breakthrough non-surgical therapies we use today. At our clinic, we focus on restoring mechanics and reactivating healing using a combination of cutting-edge, non-invasive technology. These include Class 4 medical cold laser therapy. This high-intensity laser stimulation stimulates cellular regeneration, reduces inflammation, and accelerates soft tissue repair at the microscopic level. It promotes ATP production, giving injured cells the energy they need to heal faster. Spinal and joint decompression therapy. This technique gently releases pressure on nerves and discs, creating a vacuum effect that draws nutrients, oxygen, and hydration back into the tissue. For herniated discs or sciatica, decompression can reduce pain dramatically within just a few sessions. Muscle reactivation therapy. Once pain and inflammation are reduced, we guide patients through controlled movement patterns to rebuild muscle coordination, improve balance, and restore joint stability. Shockwave therapy. Nicknamed the stem cell machine, this state-of-the-art therapy causes a local migration of stem cells to help heal damaged areas so that your body can heal naturally. This has been used in Europe for decades and is finally becoming prevalent here. These are not temporary fixes. They're structured programs designed to correct the root cause of dysfunction so the problem doesn't return. Why these therapies work so well. Think of your body as a communication network. When nerves, muscles, and joints are aligned, messages travel freely, allowing efficient movement and healing. But when one link is off, signals get distorted. That's when pain, weakness, and inflammation appear. Our therapies aim to restore clear communication through proper mechanical alignment, increased blood flow and nutrient delivery, nerve signal recalibration. As function improves, pain decreases naturally, without drugs or surgery. This process also prevents future degeneration. By improving joint stability and nerve health, we reduce the risk of arthritis progression or further tissue damage. Patient results and recovery timeline. Patients often ask, how long will it take to feel better? While every case is different, here's what we commonly see. Weeks 1 to 3, noticeable pain reduction and improved mobility. Month 2, restoration of movement patterns and increased strength. Month 3 and beyond, functional recovery, patients walking, exercising, or working without limitations. One of our recent patients came to us after being told she needed spinal fusion. Within 8 weeks of decompression and targeted therapy, her pain was gone and she was back to hiking again, no surgery required. These outcomes aren't isolated. Studies show that structured conservative care programs can significantly reduce the need for orthopedic surgery, especially in spinal, shoulder, and knee conditions. Comparing surgery versus regenerative correction. Let's be clear, there's a time and place for surgery, but too often it's used as a first resort instead of a last one. But here's what typically happens. Surgery fixes the symptom, the torn tissue, the ruptured disc, but it doesn't retrain the system. Regenerative care fixes the pattern, restoring movement, activating stabilizers, and retraining the nervous system. That's why many of our patients tell us they finally feel balanced again, not just pain-free. It's like tuning the entire engine instead of replacing one part. What to expect during your assessment. Before starting treatment, we perform a comprehensive non-invasive recovery assessment. This includes a detailed movement and posture analysis, neurologic and nerve conduction testing, structural imaging when necessary. This allows us to identify the real cause of the pain, whether it's mechanical, neurological, or inflammatory, and create a personalized plan to correct it. Our goal is not just symptom relief, it's functional restoration, helping your body heal efficiently so you can get back to living your life. In conclusion, the best surgery is the one you don't need. If you've been told surgery is your only option, pause and get a second opinion. Explore non-surgical therapies that are proven to retrain your body and stimulate healing from the inside out. Because sometimes the best surgery is the one you never need. To learn more or schedule your non-invasive recovery assessment, contact Innovative Nerve and Joint Centers today. Our team will evaluate your movement, alignment, and nerve health to see if your body can heal safely and effectively without surgery. I'm Dr. Paul Fisher. Thank you so much for watching. Have a great day.